Our profession has changed tremendously during my career. From the beginning, when we were, in my training, dispensing drugs with very little interpretation and oftentimes very little information about patients, to today when we're enabled by complex information systems and supported by automated drug dispensing systems that allow us to provide both optimal care and risk avoidance. We can work with our physician and nurse colleagues to optimize patient doses so that they can recover from or live with their chronic medical conditions as best as possible.
One of the biggest changes that we've seen in pharmacy is pharmacists as practitioners. And I think the explosion in MTM services that, really the College of Pharmacy at the University of Minnesota was a leader in. The public is just clamoring for more pharmacist involvement to help them manage complex medication therapy. I think that's been a huge change in my 30 years of pharmacy practice.
So you can actually see pharmacists in many different roles throughout the community, not only within community pharmacies such as Walgreens, CVS, but we are here in the hospitals, we are in clinics, and we are working specifically with physicians, with nurses to ultimately make sure that you're getting the best care.
I think one of the great things that's changing with pharmacy now is that comprehensive MTM services are put onto the insurance company's star ratings. We can bill for services, but now we'll actually be getting reimbursed more because the insurance companies will want to increase their star ratings too.
My job at North Memorial is really to run the antimicrobial stewardship program. And through that, what I'm really doing is monitoring our anti-infective use of the hospital and making sure that we're using appropriate selection and dosing and duration. And our goal is really to prevent resistance and to help improve patient outcomes, along with helping to decrease healthcare costs.
Current hot topic in pharmacy right now is drug shortages, which is very challenging for the pharmacist because we want to make sure that patients get the best care possible for the drugs available. So the challenges that we face at this point is making sure that we have the appropriate amount of drug or appropriate substitutes so we can treat the patients for the disease state that they currently have.
That there's a lot of talk, especially within the hospital system, with healthcare reform and how that's going to affect pharmacies and hospitals in general. And I think the next biggest step we can take as pharmacists is finding our role within the healthcare reform to lower the readmission rates, as well as looking towards the medications and making sure patients are going to be best suited to go home and not re-enter the hospital.
The government has incentivized us to reduce readmissions over time, potentially preventable readmissions, and the way we do that in pharmacy practice, or we hope to accomplish it, is by working together. And so that's, and nothing is more exciting than this work, where we have pharmacists in the clinic working with a pharmacist in the hospital, working with a pharmacist in a retail setting, all for the sake of the patient.
In the future, we expect to see pharmacists perfectly positioned with these relationships as a member of the care team to participate in patient therapy monitoring, patient teaching so that they adhere to their medication plans better and optimize things in their own best interest.
A future prediction that I see in the change of pharmacy practice is engaging and empowering the patients in driving their care plan.
But I can envision a day where a patient enters the hospital, has the diagnosis, say they come in with a blood clot. They have the diagnosis, the physician makes the diagnosis of a blood clot and hands off that therapy to the pharmacist. The pharmacist says, okay, I'll take it from here. I'll start the patient on low molecular weight heparin. I'll contact the patient in the clinic to make sure they transition well, and I'll make sure that the most cost-effective safest therapy is prescribed for them in the retail setting when they leave our hospital setting. I think, the public, we already know the public loves us. We're a trusted professional. I think they want more of us, and they want us accessible. And I don't think we just need to continue to sell the message of all the services that pharmacy is able to offer. And there's no better time to be a pharmacist right now.
I see a bright future for pharmacy, and I'm very pleased to see the caliber of the young pharmacists who come through our residency program and colleges of pharmacy, and gives me a lot of optimism for the future of our profession and our contributions to healthcare.
I know we make a difference. I am a pharmacist.
And I'm a pharmacist.
I am a pharmacist.
I'm a pharmacist.
I am a pharmacist.
I am a pharmacist, and I approve this message.